Hello, I'm Katy Mouse. I'm a student at Henderson State University in the nurse practitioner program. And today I'm going to be demonstrating sort of an IND, incision and drainage video. So I have a sterile field here with some sterile gloves on. I've washed my hands before all that. And the patient came in today with, an abscess, let's say. So first I'm going to clean my area well with the povidone iodine type cleaner. And then I'm going to numb the area up. I've got lidocaine or lidocaine with epi. My other materials are here. I'll talk about those as I get them out. So we just want to numb the patient up around the area. Want to make sure you get it good and numb. Don't want this patient to feel any of this because you will be using a scalpel to cut the area open. You wait a few minutes and ask the patient how it feels. Pressure is okay. We expect pressure. We don't want pain. So once the area is cleaned and numb, you'll want to take your scalpel and make just a tiny incision. So scalpels can be, they're all different shapes and sizes. This, I'm using an 11 blade. 10, 15, and 11 blades are commonly used. A 10 blade would be good for like a long, straight, big incision that you would have to make. A 15 blade is good for short and precise incisions, and 11 blade are also good for short, precise incisions. They have and shallow incisions. So I'm going to use an 11 blade because that's what I had, but this would actually be a pretty good option in this case because we're going to make a very short and very precise incision through the dermis or epidermis. And from there, we can start using our forceps and our hemostats or needle holders just to kind of get a good look at the area. See how far we're going in here. You can use your scissors or your scalpel again to see and approximate the area, see what we're working with, how deep it is. The ideal thing would be to somehow get this out without, opening the abscess. And I just got squirted with something. Lidocaine just came back at me. So you can cut around, get as deep as you need to get around that. And then you can start trying to pull the area and the abscess out. So whatever you have to do to remove the abscess and kind of remove it and take it off because it can get kind of really attached to inside of that skin. Now encapsulated would be great. If that doesn't work out, you would still have to try to get as much of that encapsulation out. If you were to cut this open on accident while you were using your scalpel, then you can still drain it like this and then try to get all the encapsulation out. So after this, it all depends on how deep and how big the incision is, if you need to pack it with the iodoform packing. So clean all of your area up and then you can kind of investigate and see if iodoform packing is necessary or even if a stitch is necessary or a suture. So that is how we would do our incision and drainage.